Diabeter is what we call an integrated practice unit, which means that it is a solitary clinic and we can take our own decisions. How many nurses, what we do in technology, the facilities we need in order to provide the best possible care to add most value for the patients.
With the doctors, the nurses, the dietitian, psychologist, I think that's the power of the team.
It's not a clinical style environment, it's a much more regular environment like you could find at home or in your school or in another place. It was obvious that diabetes care needed improvement.
It's a kind of personalized care that you really try to put you in the place of the patient and try to understand it and feed in your knowledge and then come together to kind of decision what is wise to do.
It has all the services and all the benefits of a good hospital in the Netherlands, but it doesn't feel like a hospital for the children and also for their parents.
At the end of the day, it should be the patients and the parents' choice because they have to deal with it most of the time.
When a kid is very young and they go to school, they often experience problems with no one understanding what needs to be done or no support. So we have support groups for that. We have meetings where dietitians explain specific aspects of food. So there are many aspects in life that we try to bring into the clinic, use the experience from other patients, because in the end of the day, it's a very important thing that we understand not only the attitudes of patients to the disease, but also their needs and also their wishes.
Here I know they can help me and I know that they will do anything they can do for you to help you with it.
The value-based healthcare method has 6 components that we really follow in Diabeter. And by doing this, we can centralize the role of the patient. The first step is the integrated practice unit. We have everyone together around the patient. The second step is measuring patient outcomes. And we measure those outcomes individual, patient by patient. We measure it in groups, but we can also measure the cost per patient. The third step is to use bundled payment systems, which means that we negotiate with insurers to get a certain price for the care, and we also explain and negotiate what we deliver for that care.
And we currently have our first contract now, which does pay an additional fee for improving the outcome if we achieve targets.
Yeah, so we're going now to outcome-related pricing, which is another important step in this system. And that brings us also to the importance of different locations working like individual IPUs, but they also work together as one IPU. But the fifth item is that we're expanding our system to other places, and then it's important to have automation.
It runs all around IT. Without IT, we couldn't do it.
All this equipment that we nowadays have, like glucose meters that can talk to the cloud, there are now even insulin pens that can talk with us, is one of the biggest assets that makes our life easier, but especially makes the life of the patient easier. One of the things that was developed in VCare by you was in what we call therapy mail, and that's a way of contacting patients with data. It gives a very good oversight of how things are going.
I can see with the colors if it's correct or not, and for me that's very helpful to visualize it.
In between the visits, they use the system to upload their devices. They get a report back in 5 minutes, and you can see how you improve and how you deteriorate. And that maybe you can get motivated to contact your team, and we already have the data. And offering this kind of IT loop improves the care tremendously.
We want to be a focused team, focused on the patient, but also that we all focus on one disease.
2 times in the week there is a meeting with a doctor, a diabetic nurse, a psychologist, dietist, and then we can discuss patients with each other. So from all the insights we can get to see the best treatment, so you can get a new point of view. It's a kind of brainstorm to come further for the best treatment for the patient.
That really helps to focus care and just to give the patients the care they need, and it really needs less time to help more patients, and I see the outcomes of the patients are even better than in the hospitals.
And then you can make the logistics of it far more efficient. You can take out all the burden of administrative processes like ordering materials, and if you make it more efficient, then the care providers can handle more patients in a year. And if they can handle more patients, their learning curve is higher. So it's not only cost-wise more efficient, but also the knowledge case really improves and the patients experience that.
I think a doctor in a hospital, he also has to go to other units, he has to go to other patients, and our doctors really focus on children with type 1, and our nurses focus at diabetes type 1, and our dietitians also. So I think that focused care can help the patient, and then you've got a unit and a system round about the patient, and that really helps.
We have a 24-hour call service directly to a medical specialist on type 1. It's one of our physicians.
You can call anytime and that you know that you have a specialized doctor and they can see your documents on the computer, so you know you're in safe hands.
And that's what VCare is helping us with, because it helps to get an insight in what's going on, but it also helps to get in contact with the patient on an electronic way, by sending therapy mail, by sending advices for the pump settings. So there's a very strong interaction nowadays between our patients and the team.
We currently have 5 locations in the Netherlands, and it works nice and we can further improve it. But how do you expand? There becomes a lot of knowledge of the different countries you need to have on the payment system, the networks with different clinics and physicians. And here Medtronic is acting as a global technology company which knows the path, how to expand. We add, let's say, the content, and they can work on the pathways to make it happen.
What we have been doing with Diabeter, fitting in the value-based healthcare concept, it's very good to see that Medtronic has this vision, and this vision of how the future of healthcare should develop. And so bringing the two together was kind of logical,
yeah.
And we are very proud to be part of that.
When you grow bigger, you get more data. And when you have more data, you get better insight. And that spirals up, let's say, the knowledge cycle and the improvement cycle.
When I'm here, it gives me the feeling that you're closer to a solution.
It's important that you try to stay connected, that more people in other related matters can benefit it.
In these days we see these kids and we see them grow, their weight is coming back, but also they grow in their confidence. They know how to deal with this disease, and that's a very, very beautiful job.
Having a system that we can communicate with our patients and give them the best advice, not only 4 times a year, but also in between, has really helped a lot of patients to improve their outcome in terms of A1C, but also improve their performance in terms of how does my life look like.
For me as a psychologist, I feel the care from the main team, and from that care on I can work as a psychologist with all the patients.
The Diabeter, it's like a community. They give you the trust that you can manage your own disease and that you're not alone.
Delivering better care for eventually lower total cost. You add so much value that in itself you create a sustainable healthcare system.
The way we do it, the value-based healthcare, the environment, the intensive connection with patients, brings out the best in everyone.
Yeah.
And eventually it means that better outcomes result in better lives, in longer lives and in healthier lives.
Yeah.
And that's a very good feeling.